Thanks very much for having me here today from the RCN Library and Archives Service. Moved a bit ahead in the programme, so we're going to talk about the future a bit earlier before the end of the day, and there are some reasons for that which I'll come to. So I work in the audience engagement team in the library and archives, which means I run the exhibitions and events programme for the library. And there's three things I'm going to talk through in this session today. I'm going to start off with a bit about our collections and how we've identified some gaps in them, some of the things we're doing about that, and then finally what you can do, how you can all contribute to the future of the archives of the RCN. For those who don't know, the RCN Library and Archives Service it runs across the UK, accessible to all RCN members. We've got 4 physical libraries in London, Belfast, Cardiff and Edinburgh, but then we have a huge online collection as well. 1,100 e-journals and 30,000 e-books that you can access from anywhere. But we're also the largest nursing-specific collection in Europe. So the historical collections go back to the founding of the RCN for the organisation, but also we've got all sorts of other collections as well that represent nursing much more broadly. Personal collections, archives that individual nurses have donated going back to 1817. We've got more than 600 oral history interviews. That's something I'm going to come back to. And then things like postcards and more than 5,000 photographs, some of which are part of the workbook that you've got today. So the images on the front and the back come from the historic collections of the RCN. But one project that we've been working on recently is to try and identify where there are some gaps in the collections and what we can do to collect these. And one of these recently, we had a call out on social media for nurses who identify as lesbians to come forward and talk about their experiences. And some of the reactions that we got were along the lines of, why would you go out and call for particular stories? Diversity in a collection is something that should just happen. Well, does it though? So particularly thinking about a collection and an archive, as well as all sorts of other assumptions, this identifies one of the assumptions people have about these historic collections, that somehow, magically, an archive holds everything. So somehow we've got everything on nursing and it just all appears in the collections. But the collections rely on donations. And certain types of people are probably more likely to donate to archives. And particularly we find from people who come from cultures where archives and these sorts of depositories are seen as natural places where history would go. But if you come from a culture or community that's more oral-based in your traditions, is more community-focused, then an archive is not necessarily going to be what you think of. So it depends who's actually going to donate things to the collection, what sorts of things they donate as well. So a lot of people will tend to focus on the professional stories, so on your on stories of registration of the items that relate to certificates and achievements like this, but this actually misses out a lot more of the broader story about nursing. So what it's like to be a nurse in 2017, or what it's like to be a black nurse in 2017. This is something that we want to be represented through the collections. So certain things are lost because people privilege particular things. So how might this shape our understanding of nursing history, the sorts of things that people are donating to collections? And I want to give you one example of how history is shaped that might put this a bit into its perspective. So this is the display that was recently put up for reflecting the RCN presidents. So this is 100 years of RCN presidents on the wall here. And we were looking recently at the online encyclopedia, Wikipedia. Does everyone know Wikipedia? So Wikipedia, again, seems to be the internet, people feel, makes every story accessible. So everything is out there because of the internet. But if you look at biographies on Wikipedia, what percentage of biographies do you think are of women? Any guesses? How many women? 10%, did someone say? It's actually slightly higher than that. But 15% of Wikipedia biographies are of women. Interestingly, this is something that has highlighted a lot on Wikipedia. 90% of Wikipedia editors are men. And sometimes the argument's thrown back that this actually just reflects what's out there. Only the prominent people are on these, are in these archives or on these repositories, so therefore there just aren't as many prominent women. But if you look at the RCM presidents, only 46% of the RCM presidents have biographies. All of those are women that should have pages on Wikipedia. But in contrast, over the same period, 85% of the Royal College of Surgeons do. So there's a difference here in who's actually being recorded and whose stories are being collected. So what do you think? How do the stories that we're actually keeping, how is that going to reflect or alter how we think about history? Any thoughts? I'll tell you some of the things that I think. So what I think is that we do need to be active in making sure that a wide range of stories are collected across, within the RCN archive, across everybody who makes up nursing today and in the past. And what happens if diversity doesn't just happen in these collections? How does this alter what we think about history? So one thing is that we risk perpetuating a particular narrative. So I've kind of summarised this as the philanthropic rich white man. This is the idea that rich white men came along and made everything okay. Has anyone come across that in school history or anything like that? Yeah, well, one example I'd give you is I remember at school being taught that women got the vote in 1918 because men decided that it was okay for women to have the vote. And in fact, I was also told that if the suffragettes hadn't been so troublesome, then men would have given women the vote earlier. So actually, it's all about those in power in this instance and what they are supposed to have conferred upon other people. So this kind of perpetuates the status quo, perpetuates this idea that certain people's stories are more important than others, and actually they're the ones altering history, which is not the case. And the other side of this, I was at a talk a while ago on a project that Hackney Archives were doing with their local sixth form college. And this was to create an A-level course looking at black history. And some of the students who were encouraged to take part in this course, one of them participated in the talk. And she, as a 17-year-old woman of colour, said that when she'd heard about the course, she didn't want to learn about black history because she thought it would be depressing. So things that she'd been taught was that there was only one side of one element, really, to black history. And as she said, I thought it would be all about slavery. Now, she and all of the other young people on this course had no idea that there had even been a black civil rights movement in Britain. They didn't know about any of the figures that were part of this. So this is the other side of this. If we don't collect everybody's stories, then this perpetuates this idea of a particular stereotype of a particular type of people, which affects people in the future, in the present and the future. And also it makes people make certain judgments and assumptions about how things come about. So there's one quote that really struck me when I was going through our archives and through some of the oral histories that we collected. And this is an oral history interview with Dr. Neslin Watson-Drouet. And she talks about how when she was growing up in Jamaica, her family were not rich, but they weren't poor. She'd never really encountered poverty before. And then comments on as a nurse when she was carrying out fieldwork practice in Brixton in the early 1970s. And she said that she came face to face with abject poverty, and I came face to face with being ashamed about being black. Why? Because I didn't understand history, I didn't understand economics, and I didn't understand how society worked. So by not understanding the wider context, how all these stories come into play, how circumstances affect people, how history affects people, then we risk making all these judgments about the situations that people find themselves in. So, on to what we're starting to try and do to address this. So in the RCN Library and Archives, we launched a collecting drive in February 2017. And this is to try and collect stories, particularly in areas that we've identified as gaps within the collection. Although we are collecting across every nurse's story, every healthcare assistant's story, every midwife, every nursing student. We want to collect across the breadth of nursing. So this isn't about not collecting some stories and collecting others in preference. It's about encouraging those, people to fill the gaps, but also to keep collecting across the board. So we were particularly collecting their stories from Southeast Asian nurses, from lesbian nurses, and from deaf nurses, all of which were not really visible within our collections. And then we also highlighted some stories that people hadn't been aware of in the collections already. We've now got an exhibition on in the Library and Heritage Centre in London, which will soon be available online as well. And this will then travel to Scotland, to Edinburgh, early next year. And then around this, we've got an event series happening around the UK. And I just want to highlight a couple of the stories that we've collected and why these types of stories are important to our collection. One aspect of the exhibition that's come through in the oral histories and the interviews that we've collected, and this is something that wouldn't necessarily have come out from the official documents, from the records that were part of our archive. And this is a story about state-enrolled nurses, or SENs. Now, for any of you who don't know, the SEN role was brought in 1943 as a cheaper alternative to state-registered nurses. It was a shorter course and therefore cheaper to run. And in the 1950s and 1960s, large numbers of state-enrolled nurses were recruited from Southeast Asia and from a number of African countries as well. But what's really coming out in the oral history interviews, which wouldn't have been noted otherwise, is that many of them were not actually given an option about training at this level. For a lot of them, they could have trained as SRNs, but they were either told wrongly that their school qualifications were not good enough, sometimes they weren't offered the GNC entrance test, and some of them were simply not told that there were different types of nursing that they could do. So this altered the experiences for these mostly women who then entered nursing at a particular level. Some of them then became SRNs, some of them were very happy as SENs, but for some of them this was problematic. So I'm not sure if you'll be able to read, certainly not through me, the quotes, so I should probably read them out to you. So we've got two different stories out of the many that we've gathered in oral histories that I've highlighted here. So the first one, Lola Oni, her mother came from Nigeria to train as a nurse in the 1950s. She wanted to be a midwife. And as Lola recounts it, she trained as an enrolled nurse. She had, you know, the usual story. She had the qualifications, but they told her she would need to do the enrolled nursing. It wasn't until literally she had been here about 6 months before she realised she could have done SRN and not SEN, which was the story for a lot of nurses in those days. And Lola goes on to recount how her mother was very angry at how this had happened, tried to transfer her course, but was told that because she was already 6 months in, she couldn't, so she'd have to finish it and then become an SRM perhaps later on. And then a slightly different experience was recounted by Steve Kimata, who came from Kenya to train as an SEN in the 1960s. And he had a more positive experience as SEN. So we want to capture that both of these experiences happened, that SENs were a valued role, but for some people this altered the opportunities open to them were very different from what they'd expected them to be. So Steve says that after completing my SEN, I think I qualified in 1968, and I then obviously started working as a qualified nurse, and I stayed there for quite some time. I must say that after qualifying, you were valued. As an SEN, you really were much valued, and you could do your job. I was in charge of the ward, and it was great. I enjoyed every bit of it, and I've still got memories of very, very nice people. I still remember my charge nurses and people that I worked with, very nice people. So this is one of the reasons why we're expanding and constantly collecting more interviews to go into the archives, that these tell you things that the official records don't. And then one other example from the exhibition that I want to give you that we're collecting, and this is to emphasise how recent some nursing histories may be. And this is the story of deaf mental health nurses. So this deaf staff started to be employed in mental health services from the 1990s. But the first profoundly deaf, so BSL user nurse was qualified in 2004. So this is very, very recent. But it's also an example of how communication and cultures can affect the way nursing and care is carried out. So among the people we interviewed, Herbert Klein, who was very involved in the setting up of deaf mental health nursing in Springfield Hospital and deaf services, comments on an example of a miscommunication between a hearing nurse and a deaf service user. So as he says, it was a particularly busy day at the nurses' station. And nurses are always stressed, of course. A patient came up trying to get the nurse's attention. The nurse, on the phone, waved the patient away. The patient flipped and pushed the table. The nurse couldn't understand why the patient was so angry. I said it was the nurse's fault. They had waved the patient away, and deaf people hate that. So there are little things every day on the wards with nurses, changing communication and culture. And I think that's can apply across a number of different areas, the little things that we do to change communication and to change culture, and that gathering these today is very important for the future. So we are still collecting. We are always collecting. We particularly want to collect the stories of Black, Asian and minority ethnic nurses, and we want, as well as collecting across the board. And when I say nurses, I do also mean healthcare assistants, midwives, nursing students. We want to collect all of these. Because I mentioned about the people reflected on Wikipedia, the kind of great names, the stories that we might know of. But those also can reflect our understanding of a particular history. So one of the names that quite probably springs to mind when you think of black nurses in Britain is Mary Seacole as a historical figure. But what was it like to be the average black British woman in Victorian times? Did other women have any experiences that were in any way the same as Mary Seacole's? By highlighting a particular figure, we miss this variety of stories. And I want you to think now about what might reflect your nursing story. So for Mary Seacole, we've got her book, which is in the book that you just saw there in the collection. this is an example from our current exhibition. So when we asked Elizabeth Ann Ionwu, Professor Elizabeth Ann Ionwu, what item might reflect her experiences and what would display in the exhibition, she chose her 7-inch of Boney M's Brown Girl in the Ring. And we've got that displayed alongside a school photograph of her as the only black child in the school. And she said until she came to...
What was my question? I can't even remember now. Yeah, the biggest change. And I felt the BME network in our trust was a big change. And I also was able to say that, you know, the lack of representation across all of the bands in our trust is quite... it's quite clear, you know, there is a big lack of representation. However, I felt that opportunities I have felt over the years have changed. For some, maybe not for everybody, but I felt that it didn't come easy to me. I asked to go on one course, and I asked in 2009, and I didn't get to go on that course until 2015. That is a long time to wait for a course that you were really entitled to go on. However, I went on the course, but what I said to Donna when she interviewed me, I just didn't give up. I kept asking, and I thought I'd got facts, figures, so I was able to say, actually, you know, yes, it's right for me to do this, to go on this course. I have waited a long time. I am as good as the next person. Why? And in the end, the facts spoke for itself, and the answer had to be, yeah, of course, we'll support you, pay and time. So yeah, so just keep going. That's what I said. Keep going and don't give up. No matter how many times they say no, just keep knocking, respectfully, but keep knocking that door. It will open eventually.
Thanks. I think that's a good note to close that discussion on. So there were a couple of... Oh, what's happened to the slide? That one. Yeah, so these are a few of the reasons why it's important to be telling these stories, to be recording these interviews. That it does celebrate the achievements that we've made. It might also release painful and difficult experiences. So we can remember that it may be difficult to be interviewed, but we need to value and acknowledge these experiences to learn lessons for them. And I think the awareness that's come through from all of the contributions that people have made today is that change doesn't just happen, equality doesn't just happen. That everybody has contributed, has struggled to get somewhere, has not been able to do something, has managed to do it despite the odds. And if we're not recording and telling these stories, then that's when people can come out with these statements that things, the grand narrative that things somehow magically just change and happen. So what's next? These are some of the things that you can do to get involved with the archives and to record your legacy and to get involved. Please contact us. The contact details on the back page of your workbook. If you'd like to have your interview recorded, then we have volunteers who go out to record interviews, so do let us know. Or we can send you some tips and you can record each other's interviews and donate them to the archive. And then finally, you should all have one of these. If you don't, there are some more over on the front desk. So this is just a simple interview sheet. And what we'd really like to do is to collect these from everybody who's here today, or as many people as would like to complete them. So long as you sign and date the back, then we can keep these in the archives. Those will be kept for the history of nursing and the future of nursing. So those will become part of the legacy, your legacy, at the RCN. Thank you.